CEN Exam Review. Question 1. A patient with mania is disruptive and not responding to verbal redirection. The patient is placed in 4-point restraints. The CEN should monitor the patient every. Option A 30 minutes for circulation, nutrition, elimination, and mental status. Option B 60 minutes. Option C 15 minutes. Option D. As needed. The correct answer is option C. 15 minutes. Restrained patients require frequent monitoring to ensure safety. In ED settings, restrained patients should be monitored every 15 minutes for circulation, respirations, nutrition, elimination, and mental status. Restraints should be used only for patient or staff safety when less restrictive measures have failed. Restraint orders require a physician's order and are time limited. Question 2. A patient presents with a sudden onset of flashes of light, floaters, and a curtain over their vision. Which diagnosis is most likely? Option A retinal detachment. Option B central retinal artery occlusion. Option C acute angle closure glaucoma. Option D vitreous hemorrhage. The correct answer is option A. Retinal detachment. Retinal detachment presents with flashes of light, photopsia, floaters, and a curtain or shadow over the visual field. It is an ophthalmic emergency requiring immediate ophthalmologic referral. Treatment includes surgical repair, pneumatic retinopexy, scleral buckle, or vitrectomy, to reattach the retina. Question 3. Which medication is indicated for status epilepticus as a first-line agent? Option A lorazepam, Ativan, 4 mg 4. Option B fosphenytoin 20 mg/kg 4. Option C levetiracetam, Keppra, 1 gram 4. Option D valproic acid 20 mg/kg 4. The correct answer is option A. Lorazepam, Ativan, 4 mg 4. Benzodiazepines are the first-line treatment for status epilepticus. Lorazepam 4 mg 4, or diazepam 10 mg 4, is the preferred agent. If the seizure continues, second-line agents include fosphenytoin, valproic acid, or levetiracetam. Airway management and ABCs are priorities. Early treatment reduces morbidity and mortality. Question 4. A patient presents with a sudden onset of sharp, pleuritic chest pain and shortness of breath, but no trauma. Lung sounds are decreased on the left side. What diagnosis should the CEN suspect? Option A spontaneous pneumothorax. Option B pulmonary embolism. Option C pericarditis. Option D pleurisy. The correct answer is option A. Spontaneous pneumothorax. Spontaneous pneumothorax occurs without trauma, often in young, tall males or patients with underlying lung disease, COPD, asthma. It presents with sudden, sharp pleuritic chest pain and dyspnea, with decreased or absent breath sounds on the affected side. Management includes observation, supplemental oxygen, or chest tube placement depending on size and symptoms. Question 5. What is the initial fluid of choice for a patient with hypovolemic shock? Option A lactated Ringer's solution. Option B normal saline, 0.9% NaCl. Option C dextrose 5% in water, D5W. Option D blood products. The correct answer is option B. Normal saline, 0.9% NaCl. Normal saline, 0.9% NaCl, is the initial fluid of choice for hypovolemic shock, hemorrhage, trauma, etc. It is isotonic and rapidly expands intravascular volume. Lactated Ringer's is also acceptable but should be avoided in liver failure. D5W is not appropriate for volume resuscitation, it distributes into total body water. Blood products may be needed, but crystalloids are the first line. Question 6. Which triage system is used in mass casualty incidents? Option A START, simple triage and rapid treatment. Option B, SALT, sort, assess, life-saving interventions, treatment/transport. Option C, Manchester triage system. Option D, both A and B. The correct answer is option D, both A and B. START, simple triage and rapid treatment, and SALT, sort, assess, life-saving interventions, treatment/transport, are the triage systems used in mass casualty incidents. START categorizes patients into 4 categories: red, immediate, yellow, delayed, green, minor, black, deceased/expectant, based on respirations, pulse, and mental status. SALT is a more comprehensive version. Question 7. A patient with a stroke is being transferred to a comprehensive stroke center. Which law applies to the transfer? Option A, EMTALA. Option B, HIPAA. Option C, OSHA. Option D, ACA. The correct answer is option A, EMTALA. EMTALA governs the transfer of patients between hospitals, ensuring that patients are transferred only after they have been stabilized, or if the benefits of transfer outweigh the risks, and that the receiving facility has accepted the patient. The transfer must be done with appropriate documentation and personnel. EMTALA applies to emergency care. Question 8. A patient with increased intracranial pressure, ICP, from a head injury has a Glasgow Coma Scale, GCS, of 8. Which finding is most concerning for elevated ICP? Option A, Cushing's triad, hypertension, bradycardia, irregular respirations. Option B, tachycardia and hypotension. Option C, dilated pupils with brisk response. Option D, restlessness. The correct answer is option A, Cushing's triad, hypertension, bradycardia, irregular respirations. Cushing's triad, hypertension, bradycardia, and irregular respirations, is a classic, late sign of increased ICP, indicating brainstem compression and imminent herniation. This requires emergent intervention, elevating the head of the bed to 30 degrees, hyperventilation, target PaCO2 30 to 35 mmHg, osmotic therapy, mannitol or hypertonic saline, and possibly surgical decompression. Tachycardia and hypotension suggest shock, not elevated ICP. Unilateral pupillary dilation suggests herniation. Question 9. A patient with COPD presents with severe dyspnea, confusion, and cyanosis. ABG shows pH 7.25, PaCO2 65 mmHg, PaO2 55 mmHg. The CEN should anticipate. Option A, non-invasive positive pressure ventilation, BiPAP. Option B, high-flow oxygen via non-rebreather mask. Option C, bronchodilators only. Option D, immediate intubation. The correct answer is option A, non-invasive positive pressure ventilation, BiPAP. This patient is in acute respiratory failure with hypercapnia and acidosis. BiPAP is the first-line intervention for COPD exacerbations with respiratory acidosis, as it can reduce the need for intubation. High-flow oxygen should be used cautiously in COPD patients to avoid suppressing the hypoxic drive. Bronchodilators should be given, but BiPAP is the priority for this acidotic patient. Question 10. A patient presents with sudden onset of right-sided weakness, facial droop, and aphasia. The last known well time was 3 hours ago. What is the priority action? Option A, obtain a stat CT head, non-contrast. Option B, administer aspirin 324 mg. Option C, start 4-alteplase, TPA. Option D, obtain an MRI. The correct answer is option A, obtain a stat CT head, non-contrast. This patient is having an acute ischemic stroke. The priority is a stat non-contrast CT head to rule out hemorrhage before administering TPA. The time window for 4 TPA is within 4.5 hours of last known well, this patient is within the window. However, CT must be done first to rule out hemorrhagic stroke, which is a contraindication to TPA. Aspirin may be given after TPA is ruled out. Question 11. What is the correct compression to ventilation ratio for adult CPR with an advanced airway in place? Option A 30:2. Option B 15:2. Option C continuous compressions at 100-120/min with breaths every 6 seconds. Option D continuous compressions at 80/min with breaths every 8 seconds. The correct answer is option C. Continuous compressions at 100-120/min with breaths every 6 seconds. When an advanced airway, ET tube or supraglottic airway, is in place during adult CPR, continuous chest compressions at a rate of 100 to 120 per minute are delivered without interruption for ventilations. 1 breath is given every 6 seconds, 10 breaths/min. The 30:2 ratio is for CPR without an advanced airway. Question 12. A patient with frostbite to the fingers should be managed with Option A rapid rereading in water at 37 to 40 degrees Celsius. Option B dry heat, e.g., warm blankets. Option C massage to the affected area. Option D surgical debridement. The correct answer is option A. Rapid rereading in water at 37 to 40 degrees Celsius. Frostbite is managed with rapid rereading in warm water at 37 to 40 degrees Celsius, 98.6 to 104 degrees Fahrenheit, for 15 to 30 minutes. Rereading should be done until the tissues are thawed. Analgesia is needed due to pain. Dry heat, e.g., warm blankets, is not recommended as it can cause burn injuries. Massage can cause tissue damage. Surgical debridement may be necessary after rereading if necrosis occurs. Question 13. A patient with a dislocated shoulder should be assessed for which complication? Option A vascular injury. Option B nerve injury, axillary nerve. Option C fracture. Option D. All of the above. The correct answer is option D. All of the above. A dislocated shoulder requires a neurovascular assessment before reduction to identify any injury to the axillary nerve or axillary artery. Fractures, Hill-Sachs lesion, Bankart fracture, may also be present. Documenting the neurovascular status is essential before and after reduction. The patient should have an X-ray before and after reduction. Question 14. Which assessment finding indicates spinal shock? Option A loss of reflexes below the level of injury. Option B muscle spasticity. Option C hyperreflexia. Option D autonomic dysreflexia. The correct answer is option A. Loss of reflexes below the level of injury. Spinal shock is a transient condition following acute spinal cord injury characterized by loss of reflexes below the level of injury, flaccid paralysis, loss of sensation, and bowel/bladder dysfunction. This phase lasts hours to weeks and is replaced by hyperreflexia as spinal shock resolves. Autonomic dysreflexia is a later complication. Question 15. A patient with hyperkalemia has a potassium level of 6.8 milliequivalent/L and peak T waves on ECG. Which intervention should the CEN anticipate? Option A sodium bicarbonate. Option B calcium gluconate. Option C insulin with dextrose. Option D. All of the above. The correct answer is option D. All of the above. Hyperkalemia management includes membrane stabilization, calcium gluconate, to protect the heart, shifting potassium into cells, insulin with dextrose, sodium bicarbonate, beta agonists, and removing potassium, K-oxalate, dialysis. Calcium gluconate is given first if there are ECG changes, peak T waves, widening QRS. Insulin with dextrose and sodium bicarbonate shift potassium into cells. K-oxalate or dialysis removes potassium. ECG changes indicate a life-threatening emergency. Question 16. A patient presents with suicidal ideation and a specific plan to overdose on pills. The CEN should: Option A. Ask the patient to sign a no-harm contract. Option B. Place the patient on a 1:1 observation and initiate a psychiatric hold. Option C. Discharge the patient home with a safety plan. Option D. Administer a benzodiazepine to calm the patient. The correct answer is option B. Place the patient on a 1:1 observation and initiate a psychiatric hold. Patients with suicidal ideation with a specific plan require 1:1 observation, suicide precautions, and a legal psychiatric hold, 5150, Baker Act, etc. A no-harm contract is not sufficient and may provide a false sense of safety. Discharge is contraindicated. Benzodiazepines may be used for agitation but are not the primary intervention. The CEN should remove all potential self-harm items, sharp objects, belts, etc., and ensure constant observation. Question 17. A patient with a communication barrier, e.g., non-English speaking, deaf, requires interpretation. The CEN should: Option A. Use a trained medical interpreter. Option B. Use a family member. Option C. Use a bilingual staff member. Option D. Use a phone interpreter. The correct answer is option A. Use a trained medical interpreter. Effective communication is essential for patient safety and ethical care. A trained medical interpreter, in person, phone, or video, should be used to communicate with patients who have a language barrier or are deaf. Family members or friends should not be used for medical interpretation due to the potential for errors and breaches of confidentiality. Bilingual staff who are trained as interpreters are acceptable. Question 18. A patient with a tracheostomy tube dislodges it. The CEN should: Option A. Call respiratory therapy. Option B. Reinsert the tracheostomy tube immediately. Option C. Cover the stoma and ventilate via bag mask over the mouth and nose. Option D. Suction the stoma and reinsert a smaller tube. The correct answer is option C. Cover the stoma and ventilate via bag mask over the mouth and nose. If a tracheostomy tube dislodges, the CEN should cover the stoma with a gloved hand and attempt to ventilate via bag mask over the mouth and nose. If ventilation is not effective, the stoma may be used for ventilation, with a smaller tube or tracheostomy obturator. Reinsertion should be attempted by trained staff. Blind attempts can create a false passage. Suction and airway support are priorities. Question 19. A patient with suspected influenza should be placed on which type of precautions? Option A. Contact precautions. Option B. Droplet precautions. Option C. Airborne precautions. Option D. Standard precautions. The correct answer is option B. Droplet precautions. Influenza is transmitted via respiratory droplets, coughing, sneezing, or talking. Patients with suspected influenza should be placed on droplet precautions, a surgical mask within 3 feet of the patient, and the patient should wear a mask when leaving the room. Airborne precautions are for TB and measles. Contact precautions are for C. diff and MRSA. Question 20. A patient with a suspected hemorrhagic fever, e.g., Ebola, should be managed with: Option A. Strict contact and droplet precautions. Option B. Airborne precautions. Option C. Standard precautions. Option D. Enhanced contact and droplet precautions. The correct answer is option D. Enhanced contact and droplet precautions. Hemorrhagic fevers, Ebola, Marburg, Lassa, require a high level of isolation, enhanced contact and droplet precautions, including double gloves, impermeable gowns, face shields, and shoe covers. These patients should be in a single room with dedicated equipment. The CEN should follow the facility's protocol for high-consequence infectious diseases. Airborne precautions may also be used in some settings. Question 21. A patient with acute pelvic pain, vaginal bleeding, and hypotension has a positive pregnancy test. Which intervention is the priority? Option A, transvaginal ultrasound. Option B, 4 fluids and cross-match blood. Option C, beta HCG level. Option D, surgical consultation. The correct answer is option B, 4 fluids and cross-match blood. This patient is hemodynamically unstable, hypotension, positive pregnancy test, vaginal bleeding. The priority is stabilization with 4 fluids and preparation for blood products, as a ruptured ectopic pregnancy is likely. While ultrasound and surgical consultation are important, volume resuscitation is the immediate priority to prevent hemorrhagic shock. Question 22. A patient has a left-sided stroke. The CEN should anticipate. Option A, right-sided weakness and expressive aphasia. Option B, left-sided weakness and neglect. Option C, right-sided weakness and impulsivity. Option D, left-sided weakness and aphasia. The correct answer is option A, right-sided weakness and expressive aphasia. A left-sided, dominant hemisphere stroke typically results in right-sided hemiparesis and aphasia, expressive or receptive. A right-sided stroke causes left-sided weakness and neglect, ignoring the left side of the body and environment. This knowledge helps prioritize interventions, including swallowing assessment, dysphagia, speech therapy, and fall prevention. Question 23. Which law requires screening and stabilization of patients in the ED, regardless of ability to pay? Option A, HIPAA. Option B, EMTALA. Option C, OSHA. Option D, ACA. The correct answer is option B, EMTALA. The Emergency Medical Treatment and Labor Act, EMTALA, requires that anyone coming to an ED must be screened and stabilized, regardless of their ability to pay. This applies to all hospitals that participate in Medicare. Patients cannot be transferred without being stabilized, unless medically indicated. EMTALA ensures access to emergency care for all. Question 24. A patient with a pulmonary embolus is receiving heparin. The CEN should monitor for which complication? Option A, bleeding. Option B, heparin-induced thrombocytopenia, HIT. Option C, allergic reaction. Option D, all of the above. The correct answer is option D, all of the above. Heparin has multiple complications: bleeding, due to anticoagulation, HIT, immune-mediated thrombocytopenia, and allergic reactions. Monitoring includes APTT, for therapeutic effect, platelet count, for HIT, and bleeding assessments. HIT should be suspected if the platelet count drops significantly. Alternatives include direct thrombin inhibitors, argatroban, if HIT occurs. Question 25. A patient with a suspected stroke has a blood pressure of 190/105 mmHg. The CEN should: Option A, administer 4-labetalol to lower blood pressure. Option B, permit hypertension unless the patient is receiving TPA. Option C, administer sublingual nifedipine. Option D, start a nitroprusside drip. The correct answer is option B, permit hypertension unless the patient is receiving TPA. In acute ischemic stroke, hypertension is often permissive to maintain cerebral perfusion pressure, CPP, in the ischemic penumbra. Routine blood pressure lowering is not recommended unless the patient is a candidate for TPA, in which case BP should be lowered to 185/110 mmHg before TPA administration. After TPA, BP should be maintained 180/105 mmHg.